Welcome to the Health Matters program produced by the Ministry of Health. I'm your host, Alicia Martin. Joining me on the program is Ms. Crystal Crawford, the head of the Medical Entomology Department at the Vector Control Services. Welcome to the program, Ms. Crawford.
Thank you.
So I know Mosquito Awareness Week is upon us, and so today we want to talk a little bit about Mosquito Awareness Week as well as vector-borne diseases. But before we get into that, could you tell me about the Entomology and Aedes department? How does this department function on a day-to-day basis?
Sure. So the Aedes Entomology Department is actually two departments in one. And the Aedes are comprised of what we call the frontline soldiers. These are the field assistants, senior operator inspectors. These are the ones that will go out into the field. They will do the house inspection. They will do what we know as fogging. And the entomology department now, they are primarily composed of the biologists. They would go and do capturing exercises, insecticide resistant testing, larviciding, species identification, etc.
Wonderful. I know that you guys do a lot of field work. Tell me, how does the public respond when you go into areas and even into the regions in terms of fogging and all the other exercises that you guys do?
Well, the response is mixed, but it's generally receptive. I mean, persons understand the importance of what we do. So when we go out into the field and we interact with them and we help them to understand why we're here, the response is generally good.
Awesome. Mosquito Awareness Week. Tell us, what is the significance of this observance?
Well, Caribbean Mosquito Awareness Week is celebrated this year, from May 13 to 17 under the theme, Small Bite, Big Threat, Stop Disease Transmission, Start Source Reduction. So on that premise, we want to encourage persons to not just require fogging, but understand the importance of mosquitoes, understand the importance of cleaning up the environment, understand the importance that we also play a part in helping to reduce mosquito diseases in our country.
Indeed, a collaborative effort is definitely needed.
Right.
Do you guys have any activities planned? What can the public look forward to?
Right, so we have many activities planned, which is geared towards community involvement, mosquito awareness. We're going out into the schools, help the children to understand the importance of mosquitoes and the part they play. We have different activities. We go to different ports to advertise and to engage with persons.
Thank you, Ms. Crawford. We're going to go into a break and be right back.
Dengue is a flu-like illness that is transmitted by the Aedes mosquito infected with the dengue virus. The dengue virus has 4 serotypes, so you can be infected with dengue up to 4 times. To curb the spread of dengue, eliminate all mosquito breeding sites in and around your homes, as well as in your community. No mosquito, no dengue.
Contractors have the primary responsibility to control mosquito breeding sites at any construction site. It is important that you store all equipment away from rain to avoid collection of water. Discard unwanted articles and clean drains regularly. Covering holes is also another way to reduce mosquito at your work site.
My name is Reason Niles Robin, and I'm the Director acting for Vector Control Services within the Ministry of Health, Guyana. Malaria continues to pose a significant health risk to our families, especially in the mining areas where many of our community members work tirelessly to support their loved ones. LLINS, or long-lasting insecticide-treated nets, are powerful tools in our fight against malaria. These nets have proven to reduce the transmission of malaria by providing a barrier against mosquitoes that carry the disease. But who are we targeting with this campaign? Our focus is on the most affected member of our community, those living and working in the mining areas where the risk of malaria is highest. It is our duty to ensure that every family, every child, and every individual has access to the protection they need. Long-lasting insecticide-treated nets mass distribution campaign 2024. The use of long-lasting insecticide-treated nets is the major vector control strategy adopted in Guyana. Within the National Malaria Strategic Plan, under Strategic Priority Number 4, it has outlined one of its goals as the need to optimize the distribution and the use of these treated nets in malaria-affected communities within Regions 1, 7, 8, 9, and 10. This will be achieved through the mass distribution of free insecticide-treated nets to be held every 3 years in Guyana, an activity which will be supported by continuous net distributions through multiple channels. This activity will also be supported through the implementation of social behavior change and information, education, and communication (IEC) materials in response to the limited access to and the use of this important prevention tool. The distribution process. The LLINS distribution will be implemented in one of 3 methods. Firstly, bed nets and hammock nets will be distributed by the health staff in the respective localities to the residents' population of the nearby village. Secondly, the nets will be distributed to the tishals of distant villages in order to facilitate the distribution to the indigenous and non-indigenous population. And thirdly, LLINS will be distributed to camp owners, managers, and mining organizations for distribution to their personnel. In order to uplift your free treated nets, you will need to present a form of identification for the personal details to be collected on the net distribution form. For example, the ID card number, or birth certificate number, or passport number, or driver's license number, etc. Where the recipient is unable to read or write, an ink-stamped right thumbprint will be required. If there is no right thumbprint, then the left thumbprint is required as proof of receiving a bed net or a hammock net. Let us unite in this endeavor. Let us take a stance against malaria and protect our loved ones. Together we can create a healthier, safer future for all as we unite against malaria.
Welcome back to the program. Ms. Crawford, could you tell us what are the types of mosquitoes that are most prevalent here in Guyana?
Well, we would say the mosquitoes that are of medical importance in Guyana, they can be categorized mainly as arboviral or parasitic. So the Aedes aegypti is an arboviral, and that one mosquito is responsible for 4 diseases in Guyana that are of medical importance: dengue, chikungunya, yellow fever, and the Zika. While the parasitic mosquitoes are what we know it as the malaria mosquito or the Anopheles, and this infects human beings with the plasmodium parasite, and it causes malaria.
Okay, with these vector-borne diseases, what symptoms should persons look for?
Well, fever, chills, nausea, muscle pain, some vomiting. So we know dengue as it has eyes now because of the deaths that are occurring, or
Yes.
the increased dengue cases that we would describe it as. And the severe form of dengue is called hemorrhagic because it causes bleeding. And severe bleeding could result in, deaths.
Okay, for persons who may experience some of these symptoms, where can they go to get treatment?
Well, in different regions, there are various testing sites, and each region would have published these testing sites. So we encourage persons to go and get tested so that you can be adequately looked after and treated.
Definitely. You mentioned malaria, and I know the Ministry of Health has recently launched the mass net distribution campaign in, I think it was Region 9.
Yeah.
And so they are trying to put up a barrier against persons getting malaria and so on. The mosquito that causes malaria, what's the name of that mosquito?
Anopheles.
Anopheles.
Yes.
Okay, and how can persons prevent this, not only the transmission, but the spread of malaria in their communities, in their regions?
Well, malaria is usually endemic to the regions that are known as forested, regions 1, 7, 8, and 9, and mining camps are usually the areas of focus. So we encourage persons to protect yourself. You can wear long sleeve clothing. You can use insect repellents. And of course, our nets that the ministry is giving you, it is coated with pyrethroids, and that helps with protecting you from the bite of mosquitoes.
So, what would be your advice to the public? I know that you guys go around and you guys do a lot of fogging and so on. How receptive are those persons in the different regions and in the areas that you guys would visit?
Well, like I previously mentioned, the response is mixed. But persons, when they hear, oh, a spike in dengue cases, the first response for them is fogging. But that's basically, or usually, or scientifically, supposed to be the last response. The first response is investigation. You go into the environment, you go into the field, and you look for breeding sites, you do your inspection, and you kill the larval forms. Because when you kill the larval forms, obviously they can't emerge into adults. So how does the public play a part? Well, the onus is on you, the onus is on us to keep our environment clean. A mosquito can breed in the smallest amount of water, for example, a cork. So the onus is on you, like I keep mentioning, to ensure that your environment is clean, because when you clean it, you eradicate breeding sites. And of course, our minister is advocating for persons, to keep your environment clean and not just depend on the fogging aspect, which kills the adult form. But if we can target the larval forms, we're going to see major changes in the cases.
Definitely.
Here are a few tips on how we can get rid of or reduce mosquitoes around our home. Clean water blockage in the roof gutters and drain regularly. Don't keep any solid waste, for example, leaves or plants on rooftop. Clean and scrub all storage containers like drums, tanks, and buckets regularly. Turn over or cover containers not in use. Puncture holes in tires or fill them with sand to avoid mosquito breeding sites.
If you test positive for dengue, please be advised to drink lots of fluids, get enough rest, sleep under a mosquito net, and use insect repellent. And only use Panadol or Tylenol for relief of fever and pains. Do not use aspirin or NSAIDs, which include ibuprofen and Aleve.
In the region of the Americas, there have been an increase of dengue cases. The latest stats would show that you probably have more than 5 million cases across the region of the Americas. Brazil is one of those countries that have been severely affected, and as well as Peru. Dengue, as you know, is a mosquito-borne infection, and it's caused by the dengue virus. There are 4 types of dengue virus, and for simplicity, they're named dengue virus 1, 2, 3, and 4. Now, why that is important is that if you were infected with one type of dengue virus, it doesn't give you immunity for the others. And very often, if you were infected with one type of the virus and then subsequently got infected with another type, then for those patients, we see that they have a more severe form of dengue. Clinically, what we have noticed is that the dengue disease, if you like, once you're infected, a person would go through 3 phases. The first phase is a febrile phase, and that can last maybe from 1 to 3 days. In more extreme cases, it can go up to 7 days. In that first 3 days, people would have symptoms of fever. That's why we generally call it the febrile phase. For most people, that after that 3rd day, fever would subside, they'll start getting better. But for some people who get the more severe form of dengue, you move from that febrile phase into what is called a critical phase. And that can last between 24 to 48 hours. During that period, what is happening in the body, you will have plasma would leak into various parts of the body. And that can result in severe dehydration of that person. And plus you can have bleeding. So the person then goes into shock if they're not treated appropriately and in a timely manner. They can go into shock. And we also see various forms of bleeding in that person. And you can see signs of that by changes in the skin. So you can have spots on the skin, rashes and so forth. And some people might be vomiting blood. Others might complain of abdominal pains. And if somebody goes to the toilet, you can see dark stool, which is also a sign maybe that they have internal bleeding. People's skin generally becomes very pale, so you know that they have some form of bleeding and blood loss. So that's the critical phase. And it's important that if anybody is experiencing any of these signs or symptoms, that they come urgently to the hospital so that the medical professionals can make an intervention. And then once that phase subsides, you go into a convalescent phase, basically meaning that you're recovering. And that can take a couple of days to a couple of weeks, depending on how severe you might have had the disease. Now, for this year, we were able to do approximately 11,240 tests so far. And of those tests, we have identified 2,852 persons who have tested positive for dengue. And of those persons who have tested positive, we have seen 265 of them needing some form of hospitalization. We have had, so far for the year, we have had 2 deaths resulting from dengue. The regions that are affected would be regions 4, 2, 10, 6, 9, and 1. And so we continue to have intensive monitoring of these regions. Now, since it's a mosquito-borne infection, the way that we can prevent the transmission of dengue is to make sure that we kill the mosquito. Now, how can we do that? Well, one way is to fog various breeding sites. And we have intensified fogging in almost all of the regions. We have teams that go out and do the fogging. And mosquitoes have a particular time in which they would be more active. So in the evenings, that's the time when they're most active, and early in the mornings. So our teams would generally go out in the evenings to do the fogging and then early in the mornings. So right now we have various teams across the country doing this. The ministry, we have bought a lot of the chemicals that are needed for fogging, and we have a number of fogging machines, and we have deployed them with staff to the different regions. So by doing that, we would see that the vector that is transmitting the virus would decrease. This week, we have started to see a decline in cases. So that's a positive side. And that's because of the fogging activities that we have that are ongoing. We have also, another way that we can impact on the mosquito population is to make sure that the larvae that you have in stagnant water, that we are able to kill that. So we have a chemical that is a larvicide. It's called Abate, and we have also been distributing that to various communities, various regions, and encouraging people to put that into stagnant water. So if that is a breeding site, then we can kill the mosquitoes. So these are measures that from the ministry, from the region, from the government that we've been taking. But people themselves can also take measures. And if you have stagnant pools of water in and around the place where you're living, then you should help us to remove those stagnant pools. If your community, if there are lots of mosquitoes in that community, you can use insect repellent and so forth. So there are things that you can do to prevent being bitten by these mosquitoes, because we wouldn't know which one is carrying the virus or not. So it's better to take these precautions by preventing getting bitten by mosquitoes. So these are the standard things that we can do, and I hope that people would take these precautions very seriously. Now, one of the things that we have noticed is that persons might get fever, and they would attribute that to getting flu, so they don't bother to come to the health center, to the hospital. If you have a fever, we are encouraging people to come to one of our facilities so that we can test you, because you don't know what is causing the fever. And we can test you, and then we can advise you accordingly. Another thing that if you have fever and you don't know whether you have dengue or not, then if you get a fever, it's advisable not to use aspirins, because aspirin would contribute to bleeding. So if you have a fever, the best thing to use is paracetamol. And that, paracetamol, one of the side effects, it doesn't have this bleeding as a side effect. Aspirin does have that as a side effect. We have been working very hard. I mean, there's no specific treatment for dengue, at least in its mild form. As I said, in most places, you advise people to use paracetamol. We don't want people to be dehydrated, so we encourage them to take a lot of fluids. So that's in the mild form. If you have a more severe form of dengue, and maybe you're getting reinfected, then we'll want to see that person come to the hospital. And if we detect that they have any sign of dehydration, then we can give them fluids. If they are going into shock, then there are measures that the doctors would take to prevent shock from happening. And if you have bleeding with some of the signs that I mentioned, then there would be specific interventions that the doctors would take to make sure that we can help that patient. People should be cautious, and especially with children, if they have fever, don't take for granted that they have flu. Just bring the children to one of the facilities to get tested, and so that you can be properly advised by a professional. So don't assume anything. Make sure that the children come in, because with a professional checking the child, they might detect other things that someone who's not trained would be unable to detect. Testing is widely available. We have thousands of rapid kits that we have bought, and we have made that available across the system. So in some of the affected regions, we have given them extra kits, and we've asked them to distribute them widely so that people can come into the health centers and get tested.
So for persons who may want to partner with your department in getting sensitization and awareness sessions done, how can this be done?
Sure, anyone can call the number 225-8973. That is the Office of the Vector Control Services, and they can receive any information they want. They want to collaborate with us, seek out for or reach out for information. Feel free to call at any time.
Before we wrap up today's program, do you have any words of encouragement to our listening and viewing audience?
Sure. I really want to encourage persons to come out for the Mosquito Awareness Week activities. Every day we have activities planned. We plan to go into the schools, we go into the markets, reach out to the communities, to the ports, breathing hoop stelling, perica stelling. So we want to emphasize the importance of small bite, big threat. And the slogan, stop disease transmission, reduce source reduction, because it starts with us. in order for us to see a decrease in dengue cases, we have to keep our environment clean, kill the larvae, and of course, they won't be able to emerge as adults.
Definitely. What can we look forward to from your department in the coming months ahead?
So the department is working on building our capacities in terms of training. We're collaborating with our colleagues at CARFA, PAHU, WHO. We're building our database system. We're trying to move away from the paper-based aspect in terms of tallying or reporting. We're looking to venture out and use technologies in terms of helping us identify mosquito species when we go out in the field. We're building our capacities in terms of testing for mosquito resistance, because we've been fogging with Matter for a while, and we want to see how these or how the mosquitoes have been responding. We're also looking into ways of using different chemicals. So we're working, and with the support of our minister and the government, we will reach where we want to reach.
Thank you so much for joining me on the program today, Ms. Crawford. And I trust that you and your department will keep up the good work that you guys have been doing.
Thank you.
Thank you for staying tuned to Health Matters. I'm Alicia Martin saying goodbye for now.